Hi, my name is Kirsten Johnson. I am the director of the Ozaukee County Public Health Department, and I'm going to be talking to you today about organizational structures, power, and influence. Oops, and I am going to screw up the slides immediately. The objectives for today are to analyze relationships between mission, vision, philosophy, and organizational structure. Analyze factors that influence the design of organizational structure, compare and contrast different types of organizations, value the concept of power related to leadership and management, and develop a power image for effective leadership, which really is about your future career in nursing. So, the interrelationship between mission, vision, and philosophy. It's interesting. Mission, vision, and philosophy sometimes are interchangeable in organizations, but I'm going to give you more of the generalized, if you were going to research this, what people define them as. So they ultimately provide a foundation for professional practice and within an organization. Vision tells you where you want to go in the long term, where are things headed. It can be inspirational. Mission really states why an organization exists right now. And philosophy, which sometimes is also defined as values or a belief system or core values, represent the beliefs of people who belong to the organization or what drives the organization's work. So vision statements. I see them as the more broad, more global idea. They're future-oriented, purposeful, and designed to identify the future of an organization. So for an example, that's related to nursing to be the premier neurological nursing unit in the state. So again, very broad, global ideas. A mission statement defines more what the services are provided, what kinds of technologies are used to provide those services, and what sort of resources are provided. I'm going to give you examples of these for a couple different organizations so you have a better idea of what I'm talking about. And then a philosophy statement or philosophy or values. Again, this articulates what the beliefs are of the people who work there and sort of surround the nature of the work in order to provide or accomplish the mission. So what is included in a philosophy are views and beliefs of staff and management, the stages of professional development of people who belong to the organization, the education, and then technology or resources that are available to them. So here's an example. Like I said, I'm the director of the Ozaukee County Public Health Department. We don't have a mission or a vision. We've decided to go with a purpose, and this was after days of strategic planning sessions. Long time ago, the department had a mission, but nobody can remember what it was. So for me personally, I think it's important when you're defining your mission or your vision that anyone that works for your organization can easily articulate what it is. So ours is very simple. Our purpose is to improve the health of all Ozaukee County residents. And we have a long list, I can show you, of sort of what would belong into the mission statement. So I'm just going to show it to you. It's long. I didn't include it in the slide. You can find it online. But some of the things that are included so what it says is our purpose is to improve the health of all Ozaukee County residents. And in order to do that, we will assure quality and accessible health services, promote healthy lifestyles, empower residents to make healthy decisions, educate and inform the community, and mobilize the community around existing and emerging public health needs, advocate for policies that improve health, ensure and maintain our expertise. So there's a lot of pieces here, obviously. And then finally, we defined what are our core values. So those are similar to philosophy. What are the things that drive us to achieve our mission and ultimately achieve our vision? And in our case, it's just really to achieve our purpose. Well, they're very simple, sort of humanitarian ideas. Treat everyone with dignity and respect, honor rights. Everyone has the right to good health. Serve all residents, including those who are most vulnerable, listen to the community and their needs, make decisions based on best practice and best interest of the community, emphasize community, embrace collective action, and empower people. So those are really our core values related to public health. We provide services for the public, obviously, and we're a governmental organization. The next example I have is Aurora Healthcare. I worked for Aurora briefly during my career. I know many people in the southeastern Wisconsin region work for Aurora, have worked for Aurora, so this may be familiar to some of you. But they do have a mission, a vision, and core values. Their mission: promote health, prevent illness, and provide state-of-the-art diagnosis and treatment whenever and wherever we can best meet people's individual and family needs. Kind of long, but you get the idea. Their vision is there's a better way to provide health care. We will be satisfied only when Aurora gives people better access, better service, and better results than they can get anywhere else. Working together, the people of Aurora will find a better way. So for those of you who worked for Aurora, you know, you've heard that many times. Aurora will find a better way. And their values, again, they define them as values. If you look it up on their website, they call them their Aurora values versus their philosophy, but essentially the same thing. That they believe every patient deserves the best care, they believe in responsibly managing resources, and they believe in accountability, teamwork, and respect. So again, those may be familiar to people, but ultimately, both between the health department and Aurora, we have a vision, a mission, and a philosophy. They have different names, but you get the idea, as I said earlier. So I'm going to talk about organizational structures. All healthcare organizations, businesses, all have different organizational structures. There are some commonalities between healthcare organizations, certainly between health departments. But some characteristics of those structures are complexity. So how complex is it? Division of labor, the number of levels, the geographic dispersion of units. The formalization is the amount of structure in terms of rules and policies. So highly specialized organizations with lots of professionals often have little formalization. And centralization, how decisions are made. So a good way to think about this is if everyone in an organization has to ask somebody else before a decision can be made, that means the organization is highly centralized. It means a small number of people are making the decisions for the larger organization. In an organization that's decentralized, employees are able to make their own decisions and provide their best care, best product based on those decisions. So people are more empowered in a decentralized organization. Highly centralized organizations delegate responsibility without giving people the authority to act. And some organizations can change based on new leadership. So sometimes an organization may have been very centralized, and with a new leader, it becomes more decentralized. So there are different types of organizational structures. There's a bureaucratic structure, functional structure, service line structure, matrix structure, flat structures, and shared governance. And I'm going to talk a little bit about each one of these. I know these are defined in your book, or the books that you've been reading more thoroughly, but just to give you a little smattering of what these things mean. So a bureaucratic structure is exactly what it means. It's a bureaucracy. It's standardized. It's better suited for large organizations using a tall structure. What that means, tall, is hierarchical. So you have somebody at the top with people right underneath them, who have people who report to them, who have people underneath them that report to them. So it's a long structure of people, a tall structure. There are clearly defined roles and responsibilities. So you have a CEO who has one job, a CFO who has another job, a COO who has another job. So you have very specific responsibilities all along that hierarchy. There's respect for merit, so they're respectful of people who work hard and make achievements. So a bureaucratic structure is oftentimes large organizations, like I said. So a pre-bureaucracy, it could be an organization that is a startup company, so it lacks standardization, it's new, it's common again in small organizations, and it's best used for simple tasks, so everything's totally centralized. A lot of communication in a pre-bureaucracy happens between maybe the person who founded the organization or the owner of the organization, and it happens directly between individuals. So, you know, conversations, one-on-one conversations are how decisions are made versus a bureaucratic structure where there may be advisory committees and boards that help make decisions as well. So a functional structure. It's organized around specialized tasks. So you can see here I have a little diagram. Allows for operations to happen more efficiently, but again can lack communication between those operations. So if you look at this graph I gave you, we have a CEO as a marketing department, a production department, a human resource department, IT department, and a customer service. Oftentimes, all of those people are reporting to the CEO, but they don't communicate between one another. So it can make things slow and inflexible. So let's say HR has a concern and wants to change the policy. They talk to the CEO. It may impact production, but they have not spoken to production about those changes or that policy change. So it can make it could make things not a good reflection of what the production department necessarily needs. So like I said, it allows for efficiencies because production is focusing only on production, but can have an impact and make things more complicated because there's limited communication between functional groups. Service line structures. Each organizational function is determined by the service it provides, and each service line, so again, very similar to the functional structure, but they're providing, each one of those boxes is providing a specific service. And that service can have everything within it, all the different pieces within that one service line. And oftentimes hospitals are service line structures. So if you think about a cardiology department, orthopedics department, within them they have managers, they have nurses, they have physicians that work within that department, and that department has a lot of people in different roles working on different things, but ultimately they all work for cardiology or orthopedics. A matrix structure is employees are grouped by function and product. So a team of employees is working to complete some work, and it takes advantages of strengths and makes up for some weaknesses. So if you look at this picture, we have a CEO who has some people underneath him, a business analyst, development manager, quality assurance that oversees all three. But then there's these lines across. So for example, the first product one, let's say they are processing apples. Within processing apples, they have their own business analyst, their own developer, and their own tester. So, and the product two could very well be oranges, and they have their own people working within that structure. So there are people in all those different departments working on that one single thing. So it takes advantages of strengths, and each one of those products has you're not likely to have a weakness within each one because you have specialized people working within each product division. And then finally, a flat structure. These are becoming more increasingly popular. The reason being is, again, if you think about the tall bureaucratic structure, there's lots of people reporting to lots of different people. Lack of communication sometimes occurs, or just it's sluggish. It takes a longer time for a decision to be made because it has to be reviewed by so many people. It has to work its way up the chain, for example. A flat structure is much more common now in entrepreneurial startups. There are limited intervening structures between staff and managers, so it's less hierarchical. It's more fluid, so you may have management and staff where it's much more there's much more transparency. There are conversations that are happening at the ground level that are happening between everyone. So it encourages and empowers employees to share their ideas with managers, and also encourages managers to be more communicative with their staff. So it's more of a decentralized decision making. Decisions, again, can be made across the board, and people are more empowered to bring ideas and make decisions. And again, these are becoming more increasingly popular, and I think this is also a reflection of changing leadership between generations. Finally, we have shared governance, and I'm going to it's well documented. I'm going to use an example to talk about shared governance. It's found in many hospitals that have achieved magnet status. And I'm going to use the example of Rush University Medical Center. I have friends who work there and are very empowered and really love it. It ensures that the people who are working on a problem are really the experts and the ones who can make the change happen or change the process. It's really important in quality improvement that the people who are involved in the process are able to influence the process and how it changes. So I think it's it's a great best practice, especially in healthcare. So Rush University Medical Center in Chicago, clinical nurses really are empowered and have a voice in determining their standards and quality of care. They're involved in policy making, and it really reflects and encourages them, reflects their high professional stature, really empowers them. The advantage of that, again, like I said, it empowers nurses to use their clinical knowledge and expertise to direct the work that they're doing and sustain their own professional practice, and allows nurses to network with their colleagues and others within other departments and units that may be grappling with the same kind of issues, same kind of process changes. So again, it's a much more, decisions are made, it's a much more flat structure. Decisions are made by staff and in collaboration with management versus a decision being made by management telling staff this is what you're going to do with very little input. This allows for people really to make collective and collaborative decisions. In public health, we call this collaborative leadership. It's a little different, some different terminology, but essentially means the same thing, that you're making decisions as collaboratively, and I'll talk about that again here in a minute. So with that, saying that collaborative power, collaborative leadership, I'm going to talk a little bit about power. And I just looked up these definitions in the dictionary because I thought it'd be interesting to see how are they defined. So power ultimately is your ability to produce an effect. Influence is the act or power of producing an effect without exerting that power or directly exercising command. And empowerment is promoting the self-actualization or influence of. So the idea behind this is that we need to change, well, from my perspective, and your book may have a different perspective, but the more power you share, the more you have to use. And as a nurse, you are in a unique situation where you can influence others, but with influencing, again, without apparent exertion or force. So empowering people to make decisions by giving them expert advice and giving them what they, so they can make their own decisions with your influence. An example in policies when you're trying to influence legislators, it's better to have many people with lots of expertise on behalf of your issue rather than keeping the expertise within and with yourself. Similar to working in communities, when you're sharing power and information, it really ultimately garners more support and thus power, and you're more likely to make change happen. So I shy away from saying, as a nurse, you have expertise that you should exert onto someone, and rather you have expertise that you should share so people are empowered to make decisions on their own with your expert advice. With that, I'm going to talk a little bit about the profession of nursing. I am not a nurse. I have a degree in public health, a master's degree in public health. But I do think nurses are integral to both public health and our healthcare system. Without nurses, we would be at a loss. Nursing is critical, and it's not just a job, it's really a career. And I think the same with public health. It's a career, and you need to think of it as a career. And you're not just a nurse, you're not just somebody working in public health. You have, like the previous slide, you have a lot of power and expertise, and you really can change and impact lives, and you need to use that appropriately and effectively. So some tips to be more effective as an advocate for nursing and an advocate for health is to become an active member of selected nursing organizations in Wisconsin, for example. We have a Wisconsin Nurses Association, which I know is very active, both politically, but also within your own specialties. You can find they have committees and whatnot working on different advocacy things, quality improvement, working within your own organization to make improvements. Again, sort of that shared governance piece. But it's great to be connected to people who are passionate about their jobs. So Wisconsin Nurses Association is a great segue. And then develop a powerful personal, professional self-image. Again, the Wisconsin Nurses Association, but also just within yourself, knowing that you've chosen an amazing career to make a difference in people's lives. And then finally, identify opportunities in your community. And this really, for me, speaks. We need people who are experts in health and can use some of their power to influence decisions that have an impact on everybody. So, for example, I know in Ozaukee County we have the Ozaukee County Invest Health Coalition. It'd be fabulous if we had more nurses who are involved. We focus on obesity, physical activity, nutrition, mental health, and alcohol use and abuse. And we really need people at the table who have the health background and nursing expertise to move some of our initiatives forward. Again, nonprofit agency boards, they always need people who have expertise and can share their information and share their experience in the field. And then finally, nursing and even first aid volunteering, just getting out in your community and helping with fun runs or Strawberry Fest or Summer Fest or a variety of different venues. Again, it's a way to advance your nursing skill, but also to put a positive spin on the nursing profession, because we need people who are going to be leaders. And finally, invest in your nursing career by continuing your education, which you're all doing right now, sitting in front of this webinar or this lecture. And again, making nursing your career, not just a job, something that you believe in and you continue learning. So lifelong learning is really important. Developing those networking skills, again, working with, for example, the Wisconsin Nurses Association or others within your own organization where you work, being a leader perhaps on a wellness team or working with, on policies that affect your entire organization. And then, and that's the last piece, being visible and competent in the organizations where you work and network. And then the conclusion. So numerous options exist for the way in which nursing services can be organized. Like I said, different organizations are organized in different ways. But it's important to think about where you work and what influences change and what influences policies and what influences the processes and how can you make them better and how can you really improve the quality of the care you're providing. So again, important to think about those characteristics for each of those different types of organizational structures and how it impacts or interacts with your professional career. And speaking from experience, I've left organizations because I don't think they represent the values or the principles that I have as a public health professional. And again, that said, organizations can change and do change, and with new leadership, like I said, organizations can change drastically in a short period of time. However, it is slow and deliberate, and you can certainly influence the place where you work and the profession you're in. And it's just a matter of diligence and understanding the structure that you're working within and working within that structure to make change happen. It does happen, but change is always slow. And again, you can be an important part of that change, especially if you're prepared in intellect and in spirit. So that's it. If you have any questions, please feel free to have your professor contact me. She has my contact information, or you can find me online. My name is Kirsten Johnson again. I'm from the Ozaukee County Public Health Department. I'd love to see some of you come visit us if you're interested in spending a couple hours learning about public health. There's a lot to learn that I think people aren't aware of, and we'd love to share it with you. So I hope this was useful, and that's it. Thank you very much.